What brings you into the clinic today?
Good to see you, Dr. Kath.
Good to see you.
So I woke up this morning and I was very shivery and I was hot and cold all of last night and I think I have a fever.
Oh, I'm so sorry to hear. I'm just going to have a feel. Yes, you are a little warm. We'll go ahead and check vitals. What else are you feeling?
I'm just not feeling very well. I don't have an appetite and I have a little bit of a sore throat.
Oh.
And a very light headache, not too bad.
Okay, we are entering into the cold and flu season, so let me go ahead and just ask you a few health questions here.
Okay.
I'm going to start off with your name.
Luna Lux.
And what is your date of birth?
February 1st, 1992.
Okay, amongst those new feelings that you're getting, have you checked for a fever or have you not?
No, but I can feel I have a fever. I'm very thirsty and I'm sweaty and I'm just hot and cold all the time.
Okay, and do you know when it started?
Last night around 8 p.m., right as I was about to start my night routine, all of a sudden I felt an intense fatigue and the symptoms arose.
Okay. And did you get an okay night's sleep?
I was waking up the whole night because I was shivering and just hot and cold. I was going in and out of these states and just uncomfortable overall.
Okay, and on a scale of 1 to 10, how much pain are you in right now?
Maybe a 2 with the headache, and I have some body aches as well, some muscle aches. Maybe a 4.5.
Okay. Well, you look really good to be not feeling well, but thank you so much for coming in. Do you have any allergies?
No allergies.
Okay. And are you currently taking any medication?
I'm taking melatonin at night and magnesium supplements. I'm also taking some vitamins and minerals, but no prescription medication.
Okay, very good. And are you including magnesium in with your vitamins and minerals?
Yes.
Very good. And do you follow a certain diet, vegan, for example?
No, I eat everything.
Okay, so you eat meat regularly?
Yes.
Do you have any medical history that I should be aware of? Hypotension, diabetes, or cancers in the family?
Nothing serious other than a couple of moles that I've been extracting with my dermatologist. 4 on my body, 1 on my right leg, and on my back. But other than that, I have no serious medical conditions.
Okay, very good. I'll go ahead and have a look at those. I'll keep an eye out for them to see if they look abnormal. And do you wear glasses or contacts?
I wear contacts, yes.
When was your last eye exam?
2 weeks ago, actually.
2 weeks ago. And are you currently suffering from any joint pain?
A little bit of just overall body ache, but not localized anywhere in any particular joint, no.
Any skin disorders? I know we already mentioned the moles, but have you noticed any redness or dryness?
My scalp gets very dry all the time.
Okay. Looks pretty good right now. We'll definitely do a thorough scalp check as well. And do you drink alcohol or use tobacco?
Occasional alcohol intake, 1 to 2 glasses of wine, red wine, per week.
Okay, that's actually good for you to have the red wine. Okay, have you changed anything dramatically in your exercise or in any aspect of your life recently?
No.
No, okay. And do you exercise regularly?
I try to 3 times a week on a good week, 1 or 2 times on not so good of a week.
Okay, very good. Are you feeling any lightheadedness?
Lightheadedness a little bit, yes. I think I'm just dehydrated.
Okay. And can you just stick out your tongue for me? Just trying to see if you have a dry or a rough tongue. Okay. And Again, just checking to see if you have cracked lips. Perfect. Not too much cracking going on there. So we know you're dehydrated. How many cups of water have you had today?
1, I believe. Yes.
We definitely need to up that. Okay, so I'll give you some water during the examination. And what I'll do is I'll just get started here.
Thank you so much.
You're welcome. So I'm going to be putting on some gloves here. And I'll do a thorough palpation of your head after I do the vital check. Okay, so let's just go ahead and check for that fever there. Okay, so we are at a 99.5, which is a little bit on the elevated side there. You're definitely burning up a little. Let's go ahead and check your oxygenation to make sure there's nothing wrong there. Just going to be checking your heart and your lungs. So I'll have you breathe normal for me. Take a deep breath in. And out. Breathe normal. I'm hearing S1, S2, no S3 or 4. No sign of heart disease there.
I had some heart palpitations last night, but they only lasted a couple of seconds and then they went away.
Where were they located? Breathe in.
In the middle of my chest.
Okay. Okay, breathe in as much as you can. And let it out. Any pain?
Maybe a little bit of tightness, but no pain.
Okay, I'm not hearing any crackling of the lungs or the chest area here, which is a good sign. So let me go ahead and check the oxygenation level here. 97, and then BPM is 109, which is normal, so no worries there. You are getting oxygen to your lungs according to this device.
That's good.
Have you ever had your blood pressure taken?
Yes.
So is this arm okay?
Yeah, for sure.
I'll just have you squeeze there a little bit. Perfect. You feel slight pressure. Over 78, which is normal again as well.
Yeah, I usually have normal blood pressure whenever I take it. I have a device like this at home too, and I like to monitor it, and it's usually very normal.
That's very helpful for sure.
Yeah.
I'm glad you're a step ahead of the game. Just going to be setting this aside. Okay. So what I'm going to do is I'm going to palpate your head, okay? Your face, Just want you to relax for me and let me know if you feel any pain. Just slightly open your mouth. Any discomfort there?
No.
Just gonna have a feel of your sinuses here. How are they feeling today? Are they in pain at all?
I feel like they're getting a little bit swollen. I'm definitely starting to be congested. I can feel it.
Just having a feel of your lymph nodes here, your thyroid gland. Have you ever had your tonsils removed?
No.
And do you get tonsillitis?
Never. No. I need to feel a little bit of pain right here.
Is it shoulder pain?
On my neck, down the side of my neck.
What kind of pain is it? Dull, sharp, piercing?
Dull pain. I think it's maybe radiating from my throat a little bit because I have a sore throat.
Yeah, okay. Thank you for letting me know. I'm just going to palpate your clavicles here. Let me know if you feel any discomfort. Have you been having any trouble swallowing?
No, but it hurts when I swallow.
Okay. Have you been having any dysphagia where it seems hard to swallow, like hard to swallow food? Are you throwing up at all?
No throwing up. And I'm able to swallow food. And I had supper last night and breakfast this morning, so I was okay.
I'm just having a feel of your chest area here, looking for any lumps or anything that might be of concern. Since you were saying you had a little bit of chest pain, but not initially feeling anything particular that stands out to me. Let me know if the pain does start again while we are doing this medical examination, okay? Any soreness over here?
A little bit of just overall muscle pain, but not too bad.
Okay. Alright, let me take a look at the skin with my light here. Take a look at your skin with my light. Are you normal to dry or more so oily?
Combination skin.
Eyebrow distribution is healthy and thick. Same with eyelash distribution. Equal on both sides. No abrasions or lesions of any kind. There is one mole here that I am noting. Lips are red, no crackling of the lips. Nose looks healthy. Alright, I'm going to have a look at your arm here. Do you see something here like a skin tag? Do you have any idea what that is?
Yeah, I had a mole removed from here and the biopsy was negative to any skin abnormalities, but that's the scar from it.
Oh, I'm sorry to hear about that, but I'm glad they got the mole. That could have been potentially hazardous. Okay, so I'm seeing there's a mole here. There's another one here, but you've had them checked out?
Yeah.
Just check the capillary response here. Under 2 seconds, which is great. Very clear palms and underarms. Just having a look at the underarm area, which is clear, a little bit of redness. Did you shave today?
Yes, I did.
Okay, that's from the shaving, I'm assuming. Very good. Check the other arm here. Nothing drastically popping out here. I do see a little interesting colored mole there.
It's skin indentation. I've had it for many years. I'm not sure what it is, but over 5 years now.
Good to know. Let me just check the capillary response here. Under 2 seconds. Healthy palm. Okay, and see a little bit of redness again, but it seems like it's the same as the other one. And I do see an interesting... What is that?
Yeah, so here, when I was about 7 years old, I had a piece of burning paper get attached to my skin from a fire, and it burnt and left that scar.
Wow, it's such an interesting looking scar.
Yeah, I think it's a second-degree burn.
That's crazy. I'm so glad that you weren't hurt more than that.
Yes, much worse could have happened. I was fortunate.
Wow, I'm so glad that you were left unscathed everywhere else. I'm going to go ahead and have a look at your scalp, okay? Scalp looks healthy. Hair follicles are thick and strong and compacted. No sign of hair loss or alopecia. Let me just slightly look this way. Same thing on this side. Healthy hair follicles, and I'm not noting that your scalp is dry at all today, so that's a good sign. I'm going to move on to a very simple eye examination. So I'll make sure that your contacts are still working properly. And so I'm going to do just a little bit of an eye test, which will include a Snellen chart and a few colors. So I'm going to have you hold this arm's length away from you. Okay? I'm going to point at a letter and I would like you to repeat it to me.
H, F, F, C, D, J,
And what numbers are these?
20 to 100, 20, 40,
Which circle is biggest, 9 or 2?
9,
What color is this?
green.
Very good job. Okay, that's a good sign. Looks like you have 20/20 vision. Let's check your eye color vision. Okay, if you could tell me what color this is.
Pink, yellow, green, light pink, orange.
Lovely. Okay, very good. Now I am going to have a look at your optic nerve. I just want to make sure that everything is looking good, okay? I am going to come quite close to you, and I'll just have you look right there. Just having a look at the cornea and the optic nerve. I'll have you look up if you can. No popped blood vessels. Eyelash distribution is healthy. Overall eye looks healthy. Any discomfort there?
A little bit of dryness right now, but other than that, that's it.
Okay. I'm going to go ahead and take a look at this eye here. I'm going to have you look this way. I'm going to come close. Just pulling the eyelid down, taking a look at the cornea and the optic nerve. They look healthy and intact. I'll have you look up for me if you can. No popped blood vessels. Eyelids are pink and healthy. Eyelash distribution is also healthy and thick. Any pain or discomfort there?
No.
Wonderful. I'll just be putting the ophthalmoscope to the side. And I would like to do an examination of your throat. Since you said that you have been having a sore throat, I would like to see if you've got swollen tonsils. So I'd like for you to say ah. Okay. Just pushing your tongue down to try to see if I can find the tonsils there. Okay, they are a little bit on the red side. I don't see any signs of thrush. You do have a area. Do you have a, I see that you might have had a root canal. Is that true?
I did, yes.
Just checking this side. Have you had 2 more root canals here?
Maybe when I was little, I think so.
Okay, they look healthy. Very good. And I just want to take a look at your teeth here. Your teeth look great, super healthy. It looks like you take really good care of your gums as well. I don't see any buildup there. Do you brush your teeth often?
Yes, and I try to have my teeth professionally cleaned every 2 months, no more than 2 months.
Very good, that's wonderful. Let's go ahead and do a taste test here. I'll have you stick out your tongue.
That tastes like lemon, but it's a very faint, lemony, zesty taste.
Yes, that is exactly correct. And I'm going to move on now to your nose. Have you ever had a broken nose before?
No broken nose, but I get allergies and my nose constantly runs all the time, in the spring especially, and the fall.
Let me just have a quick feel here. And you've never had, you've never hurt your nose at all during a fall?
No.
Okay, let me take a look inside if you'll just look up for me. All right, there's no abnormal discharge on that side. Very good. Same on that side. Perfect. How's your sense of smell?
I have completely lost it over the last couple of years.
Oh,
because
wow.
of my allergies. I can barely smell anything now.
Wow. Well, let's do a really quick test here. This is quite a distinct tincture.
Okay.
So let me know if you smell anything.
No. Maybe lemon again, but it's very faint.
Okay. That was correct. So that's good.
Okay, I was able to smell something then.
Yes, wonderful. I'm going to now move on to your ears here. So I'm just going to do a light palpation, okay? Any pain? Any pain?
No pain.
I'm going to go ahead and take a look into the ear to see if I can find the tympanic membrane. So I'm going to have you look this way for me. Okay. Alright, I do see the tympanic membrane is pearl gray. There's no abnormal discharge of any kind. And you have like literally no earwax at all. So you must take very good care of your ears as well, which is amazing.
Yes.
Let me go ahead and do just a little test on this side here, okay? So I would like for you to just tell me what this sound is.
Oh, spray.
Okay, and what is this sound?
Just a water bottle.
Yes, and what is this sound?
Sounds like ruffling, rustling.
Finger flutters
Yeah.
of gloves. Very
Yes.
good. Okay, so I'm going to create a sound. I'm going to create a vibration. And there'll be one prong or two. I want you to tell me which one you feel more, okay?
Okay. The second one. The second one.
Okay, very good. Let me move on to the other side. All right, I'm going to have a look into this ear. So I'll have you look this way for me. So I'm just having a look here. Tympanic membrane is pearl gray, looks very healthy. And no earwax in this ear whatsoever. Great.
Good.
So I'm going to do a few hearing tests on this side as well.
Okay.
So if you could just close your eyes and let me know what it is.
That's a spray.
Good.
It's water.
Okay. I'm going to create a vibration. I want you to tell me if 1 or 2 is stronger.
2. The first one. The second one.
Very good job there. Your ears are intact, healthy. I will now move on to the sharper dull tests.
Okay, thank you.
I do have 2 items here. One is sharp and one is dull. Do you feel those?
Yes.
Okay, let's go ahead and get started.
That's sharp. Dull. Dull. Sharp. Dull. Dull. dull, sharp, that was sharp, I believe, dull, dull, sharp, dull, dull, sharp, dull, sharp, sharp, dull. I'm not able to tell. Dull, sharp, dull, sharp, dull, sharp, sharp, dull, sharp, sharp.
Lovely. All right, if you feel fine, I'll have you lay down and we'll assess the abdomen.
Sounds good.
Is it all right with you if I lift up your shirt and lower the skirt a little?
Yes.
I'm just going to start off with a light palpation. Just going to have a feel of the organs. Any discomfort?
I have a little bit of a tummy ache, but not too bad.
I do feel the pulse in your abdomen. I am going to use my stethoscope to have a listen of your bowel sounds. Just relax, breathe normal. Don't hear any gurgling currently. When's the last time you ate?
This morning I had breakfast.
Let me take a deep breath in and out. Good. And again. And again. And again. Good. Okay. No abnormal sounds. I am going to go in and measure the abdomen here. About 13 inches from side to side. 14. 13. 9. have a look at the belly button. Have you ever had a belly button piercing?
No.
Okay, the belly button is fairly small and very clean, healthy. Do you feel this?
Yes.
Do you feel this?
Yes.
Okay. Do a quick measurement. About 5 millimeters wide, 4 millimeters, 4 milliliter, 5.2. Go ahead and measure the belly fat here. 5.3. 2.4. 1.5. 2.3. And 3.4. Okay, belly fat is healthy. Just going to palpate lightly. Let me know if you feel any discomfort. Very good. I have an object here that feels like this, okay? I want you to just say yes when you feel it.
Yes. 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 Yes.
I'm going to do sharp or dull tests. This is dull, and this is sharp. Is this sharp or dull?
Sharp. Dull. Sharp. Dull. Sharp. Dull. 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 Sharp. Dull. Sharp.
Now I'm going to do sharp, dull, or cold.
Sharp. Sharp. Cold. 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 Sharp. Dull. Dull. Cold. Sharp.
Very good. I'm going to bring the shirt down, the skirt up, and we'll focus on the soles of your feet and your toes.
Okay.
All right, what I'm going to do is just have a really quick feel of the feet, the soles here. Were you having a little bit of tenderness in this area here?
Yes.
I'm going to lift your leg up. Any discomfort?
No.
Can you move your ankle for me? And the other side? The other way? Good. Okay, perfect. Push against my hand. Lovely. Just going to bring the leg up here. Any discomfort?
No.
Okay. Can you move your ankle yourself? Good. The other way. And push against my hand. Okay. Just gonna pull the legs a little bit here. I'm just gonna feel the temperature on both legs. Good. I am going to go ahead and measure the heels. Three, 1.3, 2.4, 2, 0.3, 4, 0.2, 0.2, 0.3, 0.4, 0.2, 0.3. Very good. Going to create a vibration. I just want you to tell me when it stops.
Stopped. It stopped. Stopped. Now. Now. Now.
Going to do a quick sharp or dull test.
Sharp. Sharp. Dull. Sharp. Sharp. Dull. Dull. Dull.
I'm going to have you sit up now to focus on your back. All right. I'm going to move on to putting your hair up so we can focus on the back exam. Do you have a scrunchie? Thank you. Okay to open your gown?
Yes.
Going to listen to your back with my stethoscope. Breathe normal. Take a deep breath in and out. Deep breath in and out. And again. And again. Going to listen with the bell. Breathe in. Breathe out. Breathe in. And out. And again. Good. Just going to have a feel of the spine. Back seems healthy and strong. I'm going to have you move forward and back. Any pain?
No.
Okay. Any pain or discomfort here?
No.
Just going to do a few sensation tests and measure your back, your spine. Do you feel this?
Yes.
Do you feel this?
Yes.
And this?
Yes.
Say yes when the feeling goes away.
Yes. 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 Yes.
I'm going to create a vibration. Say yes when it stops.
Yes. 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 Yes.
And just a very quick few sharp or dull tests.
Sure. Down. Dull. Sure.
Perfect. Turn around and face me after you put your shirt on. We had a very thorough examination and assessment. I'm not noting that your fever has gotten any worse.
No, I'm actually feeling a little better than at the beginning of the exam. Yeah, you were very relaxing.
Wonderful. Well, thank you so much for coming in. If I was you, I would get an IV drip. They're down the street and they're not super expensive and they really help you hydrate when you haven't been feeling well. And get as much rest as you possibly can. And I would put a few cold cloths on your forehead and your abdomen for the night to see if you can get rid of the fever all the way.
I will. Thank you so much, Dr. Kath. You were wonderful.
You are as well.